Adversaries run. Questions have to be answered. Accountability must be had. When we vote, when we organize, change happens. In the words of my mama, if you don't vote, then you can't complain. That's right. Ladies and gentlemen, the ballot holds not just names, initiatives, referendums, and amendments, but also holds the promise of our future, the protection of our rights, and the direction of our communities. Right here in the state of Florida, women's reproductive health care is on the ballot. The presidency is on the ballot. Congress is on the ballot. And indirectly, issues such as sensible gun reform, access to health care, criminal justice reform, the combating of food insecurities, funding for our HBCUs, voters' rights, clean air, climate justice, affordable housing, rights for returning citizens, and so much more is on the ballot. Our individual political convictions aside, the act of casting our vote is an intensely personal declaration of our hopes, our demands, and our dreams. Yet some of those in power would rather see us return to a darker time, a time when the voices of women and people of color were systematically silenced, when the struggle was not for policy changes, but for the basic right to participate in the democratic process itself. But in the words of Congresswoman Maxine Waters, we are reclaiming our time. Now, you invited me to talk about nurses. Advocating for action against racial inequities. So, as the Vice President of the United States of America would say, let's get down to business. First, I want to give a full disclosure. I am not a healthcare subject matter expert. My background is social justice in arts and culture, which means for me to speak to you today, I had to do some study and research. And I'm glad I did, because I learned since your founding in 1982 and becoming a charter chapter of the National Black Nurses Association in 1994, the Central Florida Black Nurses have been a beacon of hope and been on the front line of helping communities of color heal. You uplifted countless individuals utilizing your professional skills to educate, empower, and encourage healthier living. Your work has undoubtedly saved lives, created new pathways for health equity, and continues to inspire us all. As we reflect on your history, we must also acknowledge the broader legacy of Black nurses in America. In my research, I've learned that dating back to the late 1960s and early 1970s, Black nurses were at the forefront of movements demanding equality in healthcare. They knew then, as we know now, the truth about health equity could only be achieved addressing systematic racism and inequity in all of its forms. The fight to include more Black professionals in healthcare leadership and education was not just about representation. It was about creating systems where people who looked like us could finally be seen, heard, and cared for in ways that recognize our humanity. Black nurses, you are not just frontline healthcare professionals. With everything happening in our world, you are also whistleblowers with cultural competence. You are role models for the future generation and inspiring Black healthcare professionals. And you are social justice advocates that address healthcare disparities. That's who you are. Yeah, that's who you are. That's who you are. Make no mistake about it, y'all have an identity crisis. Because if anyone knows, you know, we are living in perilous times. Right now, Black women face a maternal mortality rate 3 times higher than white women due to pregnancy-related complications. when we see how black men are disproportionately affected by heart disease, kidney failure, diabetes, and cancer leading to premature death. We see how black women are disproportionately affected by breast cancer. We have higher mortality rates compared to white women, often due to delays in diagnosis, which can be attributed to factors like access to healthcare, socioeconomic status, and potential biases in the healthcare system. We see how black patients are less likely to receive pain medication in emergency rooms compared to their white counterparts, perpetuating biases in pain management. Am I talking right? Yes. We see how black communities have less access to quality healthcare services and facilities, contributing to poor health outcomes. We see how children suffer from higher rates of asthma and other chronic conditions due to environmental factors like air pollution in predominantly black neighborhoods. We see how black families are more likely to be uninsured and underinsured, limiting access to preventative care and necessary treatments. We see how black people face higher rates of obesity, hypertension, and stroke, conditions that are preventable with timely intervention and proper health care. Y'all, we are living in perilous times. And it sounds to me like America needs a nurse.
Yep, that's right. That's right.
Now, Madam President, Ms. Eloise, leadership of this outstanding organization, you invited a lawmaker and a policymaker to be the speaker. And just so you know, I did not leave my legislative hat at the door. So I must address an elephant in the room. Now, before you get nervous, I am not about to discuss whether you are pro-choice or not. That's none of my business. However, it's time that we be real about the overturning of Roe. The groups that have been impacted the most by the overturning of Roe versus Wade are women with low incomes who cannot travel to more liberal and sensitive states, and black and brown women who do not have regular access to medical care. So whether you like it or not, striking down Roe was not only classist and sexist, it was also racist. And just so we're clear, let me put an asterisk right there and remind you that these opinions stated are that of State Representative LaVon Bracy Davis, and do not necessarily represent the opinions of Central Florida Black Nurses Association.
Okay.
But since y'all gave me the mic,
I know that's right.
let me further opine. As we navigate a landscape where access to health care is already fraught with disparities, the struggle for reproductive justice adds another level of urgency. The ability to make decisions about our bodies and our health care is fundamental. Yet for many black women, this right is increasingly under threat. For example, I am sure you heard recently about Amber Thurman, a 28-year-old black pregnant woman who died after she couldn't access life-saving termination of her pregnancy in the state of Georgia. The state's maternal mortality review committee found that her death was preventable and said a delay in care had a large impact. Whether it's dismantling of access of reproductive health services or creating barriers to safe maternal health care, black women are disproportionately affected by the policies and systems that restrict our autonomy. Period. Full stop. All right. I can't help but reflect on my own family's personal health care struggles. In the past few years, my family and I faced agonizing decisions as my father battled aggressive colon and liver cancer. My dad, who is now in heaven, endured multiple surgeries, grueling rounds of chemotherapy, and in his latter days, hospice care. That experience taught me a few things. First, that experience taught me the importance of having the power to make decisions about one's health care. The weight of making these difficult treatment decisions fell on my dad and eventually on us, my family. And I can't imagine how much harder it would have been if we didn't have the collective decision-making power or had to travel thousands of miles to give care. The government, the governor, the legislature, the Supreme Court, they weren't in the hospital room with us, dictating what should be our next decision with my dad's health care. But that moment reminded me that they are trying to do just that for women across this country in life or death situations. Those last few moments with my dad also taught me to appreciate access to quality healthcare professionals. He had great insurance. He was also a veteran. He had the best doctors, was in the best facilities, and had the best nurses. Those final and ultimate moments of comfort my dad enjoyed forced me to reflect on those who face health challenges in the most uncomfortable of circumstances. Those who lack resources, those who are poor, those who might not have access to great nurses and doctors. Because I am convinced, and my mother can attest to the same, that excellent healthcare professionals extended my dad's life, both in terms of years and quality of life. And I believe everyone should experience the blessing of having exemplary healthcare providers, specialists, and practitioners. And it scares me that access to remarkable care can be based on your socioeconomic status. And you know what, nurses and friends? Just like Martin Luther King had a dream, I have one too. I have a dream that one day the marginalized and the millionaire get the same level of care. I have a dream that the veteran with great insurance with liver cancer and the young girl who got pregnant as a result of being raped by a family member gets the same access to care. I have a dream that we do away with stigmas and we celebrate all nurses and doctors as heroes, not just the ones that cared for the sick veteran, but also the one that rendered care to the pregnant girl. And the threat of criminal prosecution and license revocation for either of them is eliminated. I have a dream that we invest in preventative care with the same energy we invest in pharmaceutical marketing. I have a dream, as I know you do too, that the haves and the have-nots are looked upon as equal in healthcare. But be that as it may, Central Florida Black Nurses Association, until my dreams and your dreams are made a reality, we are called to act, to advocate for the rights that are slipping away from too many. We have the responsibility to ensure that healthcare professionals can do their job, and in our case, their Black job.
Okay. Yeah, speak.
Yeah, I said I wasn't going to be political. I'm doing my hardest. We see how Black people across generations continue to bear the brunt of systemic failures in our healthcare system. From the lack of access to quality care to the implicit biases that shape treatment decisions, these challenges are rooted in a long history of inequity that we must confront head on. These disparities are not just numbers on a chart, they represent real lives, real families, and real communities that are impacted every day. The inequities are evident and they persist, but they do not define us. They challenge us to act. They challenge us to continue the work of healing, advocating, and fighting for justice they deserve. And that is why I'm grateful to you all. Because despite the systemic work of certain lawmakers, certain governors, and certain former presidents, and the crafters of a diabolical Project 2025, we have to rise up and let adversaries know that while we may be weary and disheartened, we are not defeated. Your presence here today is more than just a gathering. It is a powerful statement of purpose. Your unwavering commitment to using your expertise to heal, educate, and uplift speaks volumes about the strength of our community. You are living proof that in the face of deep-rooted inequities and even racism, we are far from defeated. We are empowered. You remind us all that we have the ability to shape the future of healthcare, not just for ourselves, but for generations to come. We are not bystanders to these injustices. We are architects of change. Together we have the power to dismantle the systems that have failed us too long. And in their place, we can build a healthcare system that truly reflects dignity, care, and respect that every human being deserves. This is our moment to rise, to use our collective voices and skills to demand the changes we need. Let today be a reminder that we are not powerless. We are equipped with knowledge, passion, and unity to make a difference, and we will. So while we are living in perilous times, this is not the final chapter of our story. America needs a nurse. So my question to you is there a nurse in the house? Paging Central Florida Black nurses, you are needed in the doctor's office. Paging Central Florida Black nurses, you are needed in the operating room. Paging Central Florida Black nurses, you are needed in the ER. Paging Central Florida Black nurses, you are needed in the nursing home. You are needed in urban areas. You are needed in rural communities. You are needed in health centers. You are needed in the education system. You are needed in the community. Because America, Central Florida, and people of color need to be nursed back to health. Thank you for your incredible work, and thank you for allowing me to be a part of this amazing program. May God richly bless each of you. My name is LaVon Bracy Davis, and I approve this message.